Good afternoon. My name is Jeff Harris. I'm an orthopedic surgeon here at Orthopedics Northeast. I specialize in artificial hip and knee replacement surgery. We'd like to spend a few minutes talking about osteoarthritis of the hip, what it is, and what can possibly be done for it. Osteoarthritis of the hip is really a wear and tear function primarily. The cartilage that coats both the top of the hip bone, which is called the femur, and the pelvis, which is called the acetabulum, gradually over time will soften, start to wear away, and even start to flake away till eventually the patient has a bone-on-bone situation. This will then cause the patient pain, swelling, loss of range of motion, and stiffness. Many people will see this as a difficulty in placing their socks and shoes, getting in and out of the car, having groin pain, etc. These are all indicators that the patient may be developing osteoarthritis of the hip. Oftentimes, they will then seek out attention and help for this condition. Here at Orthopedics Northeast, we certainly try to treat everybody from a conservative standpoint to begin with, which means we try to do everything we can do to keep the patient out of the operating room. Initially, we start with a physical examination, followed by usually conservative measures such as using anti-inflammatory medications, which could be in the form of over-the-counter, which would be ibuprofen, aspirin, Advil, Aleve, medicines like this. Oftentimes we'll also add physical therapy to the patient. And then ultimately, sometimes we can use an injection. Usually this is a steroid injection. If those things do not help the patient or to provide them a better quality of life, then we turn our attention to the surgical intervention. And with osteoarthritis of the hip, the surgical intervention is for an artificial hip replacement surgery. This is a basic model of an artificial hip, and really what you want to do is replace the ball and the socket. So you need to replace both sides. When we do an artificial hip, we'll take the acetabulum or the pelvis side, we'll refreshen it, and we'll place a metal socket with usually a plastic or what's called a polyethylene liner within the pelvis. On the thigh side, we'll again prepare the bone to accept a prosthesis that goes inside the bone. The ball will then attach to the prosthesis. We'll bring it back together, thus creating our artificial hip for the patient. The goal again is for relief of pain, increased activity, increased function, and a return more to a daily living lifestyle. So, that was a very quick summary on osteoarthritis of the hip. We hope it provides a little bit of benefit and guidance for you. And if we can have anything or do anything to help you, please contact Orthopedics Northeast.